Do you know what the symptoms of clogged arteries are? It's a question that merits your attention. The arteries, akin to pipelines, transport vital oxygen-rich blood throughout our bodies. But just as a pipe can become blocked, so can an artery. This blockage, often a result of unhealthy lifestyle choices, can lead to serious health issues if left unchecked. Imagine a city with its roads blocked, causing a significant disruption to its daily functioning. Similarly, when arteries get clogged, they can cause life-threatening situations like heart attacks and strokes. The heart, the city's hub, struggles to function when the roads or arteries are blocked. Understanding the symptoms of clogged arteries is as crucial as understanding the traffic rules to avoid accidents. It's a knowledge that can save lives, perhaps even your own. So let's embark on this journey of understanding, of learning to listen to the silent whispers of our bodies. Stay tuned to find out the symptoms of clogged arteries and what you can do about it. To understand the symptoms, first we must understand what clogged arteries are. Arteries, these magnificent highways of life, are responsible for transporting oxygen-rich blood from your heart to the rest of your body. They're strong, elastic, and crucial for sustaining life. However, like any highway, they can encounter traffic. In the case of our bodies, this traffic comes in the form of blockages, often referred to as clogged arteries. Essentially, a clogged artery is one that has been partially or completely blocked by a buildup of a substance called plaque. This plaque consists of several elements, including fat, cholesterol, calcium, and other substances found in the blood. Over time, these elements can stick to the artery walls, building up and hardening into plaque. This process is known as atherosclerosis. So why is it dangerous? Well, imagine trying to drive down a highway filled with traffic. It's slow, frustrating, and in severe cases completely obstructed. Similarly, when an artery is clogged, it restricts the flow of blood. This means that the organs and tissues served by these arteries don't get the oxygen and nutrients they need, which can lead to damage or even tissue death. In particular, if a clogged artery leads to the heart or brain, it can result in a heart attack or stroke, respectively. It's a silent threat, often showing no symptoms until it's too late. That's why understanding clogged arteries and how to prevent them is of utmost importance. The role of cholesterol in this process is particularly significant. There are two types of cholesterol: low-density lipoprotein, or LDL, and high-density lipoprotein, or HDL. LDL is often referred to as bad cholesterol because it contributes to the formation of plaque, while HDL is known as good cholesterol as it helps remove LDL from the bloodstream. Now that we know what clogged arteries are, let's move on to the symptoms. What are the telltale signs that your arteries might be clogged? Now, this is a question of paramount importance. Symptoms of clogged arteries can be quite nuanced, and they can manifest differently in various individuals. Let's start with one of the most common symptoms: chest pain. This discomfort, often described as a feeling of pressure or tightness, is medically referred to as angina. It occurs when your heart muscle doesn't get enough oxygen-rich blood. It's akin to a red flag, signaling that your arteries might be clogged. Next, we have shortness of breath. If your arteries are clogged, your heart might struggle to pump enough blood to meet your body's needs. This could result in you feeling out of breath, particularly during physical activities. Then there are heart palpitations. These are episodes where your heart feels like it's pounding, racing or fluttering. This irregular heart rhythm could be a sign that your heart is working overtime due to reduced blood flow from clogged arteries. Weakness or dizziness too could be indicative of clogged arteries. Reduced blood flow to the brain can cause these symptoms. If you're feeling weak or dizzy, particularly in combination with other symptoms, it might be time to consult a healthcare professional. Nausea or sweating, particularly excessive sweating, can also be symptoms of clogged arteries. These might be accompanied by an unexplained fatigue or a sudden cold, clammy skin. It's crucial to understand that these symptoms can present themselves differently in different individuals. Some people might experience severe symptoms, while others might only have mild discomfort. There are even cases where individuals with clogged arteries don't show any symptoms until they have a heart attack. So it's always best to err on the side of caution. If you're experiencing any of these symptoms, particularly if they're new or have suddenly worsened, it's advisable to seek medical attention promptly. In the end, it's about being proactive and attentive to your body's signals. Recognizing these symptoms could potentially save your life. So let's not ignore them, shall we? You might wonder, who's at risk for clogged arteries? Well, the truth is, a variety of factors can increase your risk. Let's delve into these risk factors one by one. First is age. As we grow older, our arteries naturally begin to harden and narrow, which can lead to clogs. Men over the age of 45 and women over the age of 55 are particularly at risk. Sex also plays a role. Men are generally at a higher risk than women. However, the risk for women increases after menopause. Family history is another key factor. If a close family member, such as a parent or sibling, has had heart disease, you are more likely to develop clogged arteries. Smoking, a well-known health hazard, also increases your risk. It damages the lining of your arteries, making them more susceptible to clogging. High blood pressure, high cholesterol and diabetes are three conditions that can significantly increase your risk of clogged arteries. They can damage or strain your arteries, making them more prone to buildup. Obesity is another risk factor. Carrying extra weight puts additional strain on your heart and arteries. Physical inactivity and an unhealthy diet are two lifestyle factors that can contribute to clogged arteries. A sedentary lifestyle can lead to weight gain and high blood pressure, while a diet high in saturated fats, trans fats and cholesterol can increase your blood cholesterol levels. So it's clear that a range of factors can increase your risk of clogged arteries. Some, like age and family history, are out of our control. But others, like smoking, diet and physical activity, are areas where we can take action. By understanding these risk factors, we can make changes to our lifestyle that reduce our risk. Quitting smoking, eating a heart-healthy diet, getting regular exercise, and maintaining a healthy weight can all help to keep our arteries clear. Awareness of these risk factors can help you take preventive measures. By understanding what puts you at risk, you can take steps to protect your heart and arteries and maintain your overall health. Now, how can you prevent or manage clogged arteries? Preventing or managing clogged arteries is not rocket science, but it does require a commitment to certain lifestyle changes. It's a journey, not a destination, and every step you take towards a healthier lifestyle could contribute to cleaner, healthier arteries. Let's talk about diet first. A heart-healthy diet can go a long way toward preventing clogged arteries. This includes lean proteins, a variety of fruits and vegetables, whole grains, and healthy fats, like those found in avocados, olive oil, and fish. Try to limit your intake of processed foods, sugars, and unhealthy fats. And remember, moderation is key. Next, let's talk about exercise. Regular physical activity is a fantastic way to keep your heart and arteries healthy. Aim for at least 30 minutes of moderate intensity exercise most days of the week. This could be as simple as taking a brisk walk, cycling, or even dancing. However, lifestyle changes alone may not be enough for everyone. There are medications available that can help manage clogged arteries. These include cholesterol-lowering drugs, blood pressure medications, and antiplatelet agents. It's important to remember that these medications are not a substitute for a healthy lifestyle, but rather a complement to it. In severe cases, medical procedures or surgery may be required. This could include angioplasty, where a small balloon is used to reopen the artery, or bypass surgery, where a graft is used to reroute blood around the clog. But remember, these interventions are typically the last resort, and their necessity can often be reduced or even eliminated with proper diet, exercise, and medication management. Preventing and managing clogged arteries is largely in your hands. The power of lifestyle changes should not be underestimated. They might not seem like much on their own, but combined, they can make a significant difference in your heart health. And always remember to consult with your healthcare provider before starting any new diet, exercise, or medication regimen. Remember, prevention is always better than cure. So, to recap, we've traversed the landscape of clogged arteries, a condition that affects countless individuals worldwide. We've explored their nature, the silent yet potentially fatal symptoms they present, and the risk factors that can aggravate their presence. We've underscored the importance of recognizing these symptoms early on. Symptoms like chest pain, shortness of breath, cold extremities, fatigue, and irregular heartbeats should never be ignored. They are your body's distress signals, telling you that your heart needs attention. We've also delved into the preventive measures you can take to keep your arteries clear and healthy. A balanced diet, regular exercise, and a smoke-free lifestyle are your best defenses against this hidden enemy. And if prevention fails, treatment options are available, ranging from medication to surgery. Stay heart healthy and remember to consult with your healthcare provider if you have any concerns about your heart health. It's your heart after all, and it deserves the best care you can give it.